9 days in office, and Health Cabinet Secretary Sicily Kariuki is off to ensure that medical courses are not interrupted in public university and medical colleges. The Kenya Medical Practitioners and Dentists Union Thursday last week issued a strike notice after it emerged that some universities and medical colleges have not paid allowances to their members. This is despite the agreement in the Return to Work formula and the collective bargaining agreement signed in 2017.
Health is far too critical for us to be making demands and striking when we make demands. And I think it's always important to sit around the table and speak before we issue threats. There isn't a problem that is big enough not to be resolved when both parties speak. And this is the approach that I would want to encourage and see going forward.
The Health Cabinet Secretary is calling on the Doctors' Union officials to instead seek dialogue after it emerged that the looming strike will also paralyze medical services in referral hospitals.
Let's talk. This country belongs to all of us. Ensuring UHC is attained is both my duty and the duty of the doctors and the nurses and all the practitioners in the sector. We need to talk and talk some more. We owe it to the Kenyans who have given us the privilege to go to school and to be able to serve them. So let's talk.
But even as Kariuki works towards averting the looming strike, her docket will also have to ensure remittance of funds to the Kenya Medical Supplies Authority to county governments. The CS was at KEMSA offices to flag off medicine worth 2.1 million shillings to 4 counties, said county governments owe the medical authority 2.6 billion shillings in arrears for medicine already disbursed.
I will be engaging with the respective counties to impress on them the need for them to actually pay this because they owe to KEMSA.
Quite a number of them, you realize, are new county governments and they have pending bills. This is the period in which supplementary budgets are being worked on. And during the month of March, we believe that quite a number of counties will be reducing their debts.
According to KEMSA, the arrears have affected supply of medicine in some counties.
What they are paying us at the moment and what we are giving them doesn't really it's not in harmony, and that's why the debt is either stagnating or going up.
We need to come up with a conversation with the county governors in terms of whether the resources which they are getting do not require to be earmarked that will serve the health sector. Right now, the way the conversation goes is that all the money that is transferred to the counties by the national government will be applied across all their needs.
Kariuki, while dismissing claims that there is shortage of medicine in the country, assured Kenyans that cartels peddling counterfeit drugs to patients will be dismantled. Brenda Czeda Radido, Channel 1 News.